After over 25 countries across the world reported cases of the Omicron variant, it's been reported here in India as well. Inevitable, really, the fact that you saw confirmed cases here in India considering international travel. But the information that we have is that these two who've tested positive for the Omicron variant were in Karnataka, and now the process is on to identify all the primary and the secondary contacts, to trace them and to test them. In this report, we explain all the latest updates on India's fight against the Omicron variant.
What was feared is now a reality. The Omicron variant that has the world on its toes has made its way to India. The Union Health Ministry on Thursday confirmed 2 cases have been detected in Karnataka.
24 घंटे के अंदर हमारे देश में 2 ओमिक्रॉन वेरिएंट के केस हमारे इस नेटवर्क के द्वारा डिटेक्ट किए गए कर्नाटका में। जैसे कि हमारा प्रोटोकॉल है, ना कि हमारे इंसाकॉग नेटवर्क ने उसको समय पर डिटेक्ट किया, बल्कि एज ए प्रोटोकॉल, एज ए प्रैक्टिस जो हमारी कॉन्टैक्ट ट्रेसिंग की पद्धति भी शुरू हुई है, और जितने उनके प्राइमरी कॉन्टैक्ट हैं और जितने सेकेंडरी कॉन्टैक्ट हैं, उन सबको ट्रेस कर लिया गया है।
One of them is a 66-year-old fully vaccinated man who has a travel history to South Africa. And the second patient is a 46-year-old man who is an Indian national and a health worker with no travel history. The Bengaluru civic body says the patient has left India for UAE on November 27th.
That person who has left to South Africa via Dubai has presented a certificate from a private lab showing that he is negative. And when we have tested his primary and secondary contact, none of them has been positive.
India today has learnt that both the cases are unrelated. The source of health workers' infection remains unknown. The Karnataka government is taking no chances.
We are very alarmed and cautious. Our duty is now to see that not only these 2 persons, otherwise also to track and trace such strains wherever it is found and their contacts. We are already doing the tracking and tracing of international travelers.
Since very little is known about the virus, health experts have advised caution and made it clear that it's not the time to lower guard.
There are not factor possibly is between 12 and 18 and even maybe more. That means for every person who gets infected, they could infect upwards of 12 to 18 people. That means the way it will spread is so rapid that many people will get infected. And the numbers seem to be doubling almost every day.
Right.
That is the worrisome part about its infectivity.
Think it is a lockdown sort of situation. Means imagine that it is a personal lockdown for at least next 2 weeks. Next 2 weeks are going to be very important and very vital. If you consider the reports which are coming from South Africa, till now younger people has been affected.
With 2 confirmed cases of Omicron in India and more cases likely to crop up in coming days, it is as much up to the citizens as the government to ensure there is no repeat of the horror we witnessed during the second wave. With Milan Sharma, Bureau Report, India Today.
Nolan Pinto is joining us live this morning with the latest updates on the story. Nolan, the focus right now is going to be on contact tracing. The fact is that of the 2 who had tested positive for the Omicron variant, one of them has even left India right now. Does that mean that, there was minimum contact with others? Is there a lot more primary and secondary contacts that the authorities are looking for currently?
Well, Akshita, when you're talking about the contact tracing, what we're told is both for the 66-year-old South African individual and the 46-year-old person of Indian origin who's a health worker, contact tracing was done both for the primary as well as the secondary contacts. In fact, the secondary contacts for both of them are about 200 odd each. Now, the problem is this. That individual came from South Africa and has gone back. But the authorities were like, okay, he brought it from there. But the issue now is about the 46-year-old health worker who works in a local government hospital in Bangalore. He has had no such travel history. He has not been in contact with that individual who came from South Africa. So this is worrisome because where did he actually get it from? Has it already spread in the community? Because 5 of his contacts, primary and secondary contacts, total 5 of them are COVID positive. Their samples have been sent for genomic sequencing. We should get the results, we are told by the authorities, either today or tomorrow morning. So based on that, further decision will be taken. Chief Minister Bommai also yesterday when we spoke to him, he said that today they will be having a meeting with the expert committee, the task force. They will try and figure out what needs to be done next. Based on the experts' views and the centre's guidelines, Karnataka is expected to take further stringent steps. But most important, they say, is do not panic, continue to observe COVID appropriate behavior.
All right, Nolan, we'll be getting you the latest updates on all of that and focusing, of course,